People typically come to me for a fairly specific problem, and it's usually a problem that they're scared about. They've got chest pain and they're worried about heart disease. They've got a valve that's failing and they know it has to be replaced. They have pain in their legs and they can't walk, or they're losing their legs. So what I pride myself on, what I really try to do when I meet a new patient, is put them at ease, communicate with them in a way that they understand. You know, we have options, we have treatments. There doesn't need to be a ton of anxiety around this. I try to frame when we need to do what we need to do and how we need to do, so that when they leave the office, they know that they're on the right track. I want them to know that I'm there and I'm totally focused on them. And I want to make sure that when they leave that room, they feel like they got what they came there for, that they're walking out the door and they have a plan, they have a comfortable path that we're going to go down.